So dental implants are typically used when there's a missing tooth. You know, initially 25, 30 years ago, the number one choice for a missing tooth would be a bridge, where we would actually crown the teeth on either side of the space and then connect a tooth in between. We call that a pontic. The disadvantage of that is you're putting the weight of 3 teeth on 2, or in some cases, the weight of 4 teeth on 3, and it puts a lot of stress on the adjacent teeth. It's also difficult to clean around there because you have to try to get underneath the bridge where the false teeth are, and often we see problems with decay, fractures, and other issues related to bridge work when it's cemented in permanently like that. The advantage of an implant is that we can go into that empty space and place a new titanium root form, and then a crown can go on top of that. So it actually replaces a missing tooth with a very tooth-like scenario that you can floss around and brush, and it acts like a normal tooth and allows you to, it doesn't put any more force on the adjacent teeth, so it allows you to leave those teeth untouched and place and fix a missing hole in the mouth very easily and predictably. Implants tend to be some of the longest lasting restorations we do for patients. Sometimes the crown can wear out on top, but the implant itself that integrates with the bone becomes part of that patient for their lifetime in most cases. And if you take care of them like you do natural teeth, you can keep those implants healthy and they can look good. We can even place them in the anterior area where they're right next to natural teeth, and we can get a very, very realistic result where it's hard to even tell where the implant is and where the natural teeth are. So we rely on implants quite a bit in current days, and I would say in my practice now, it's the number one choice for a missing tooth in an area, and it's our most successful long-term restoration.